So the first is neglect. So the ones we're going to be talking about today are neglect, physical abuse, witnessing domestic violence, sexual abuse, and emotional abuse. Those are the 5 main types of abuse. Now, that being said, there are many different types of trauma, but these are the types of abuse that can be reported as a mandated reporter. So that's the difference between the trauma and the child abuse. So when we're thinking about as mandated reporters, what are the things that are reportable? The first is neglect. So neglect is a failure to provide for a child's basic needs. And when we think about neglect, we're specifically thinking about physical neglect, educational neglect, medical neglect. And so neglect often is one of the most prevalent types of abuse because it's so broad when we're thinking about neglect. And so some of the neglect cases that I've worked on have been, let's say that there's not a caregiver. So a parent component is a part of every type of treatment. So we have the child's treatment, we have the parent's treatment, and they look pretty much exactly the same, except that within the child's treatment is the trauma, the creation of the trauma narrative and processing the trauma narrative. And for the parent's treatment, it's just the prepping of the joint session. So they will be prepping for the joint session by reading the trauma narrative, but they aren't creating a trauma narrative of their own. But they are doing every other step along with their child. And then the conjoint sessions are the trauma narrative sharing, in vivo planning, skill building. So there's a lot of conjoint sessions that occur and also individual work. So that being said, we might see what typically happens with a session is I meet with the parent individually for about 10 minutes at the front. So when we're doing that, I always start with a feeling brainstorm. So I say, all right, and I do this as a whole family. We're going to see how many feelings you can come up with in a minute. And I set my timer and they write down as many feelings as they can. And that gives me it's a great assessment tool for me to figure out, okay, what am I dealing with? Do I have a kid who has a very large feeling vocabulary already, or am I dealing with a kid who only has the main 4? And so then once I figure out what they have, I'm going to start educating them on different feeling words. So there are so many fun ways to teach this. The feeling flashcards are really fun, and I often use it as kind of the game Taboo. I don't know if you guys remember that game, where you pick a card, and let's say I got angry. I'm then going to try to describe a situation, and you're going to try to guess what that, or maybe I'll do charades and I'll act something out with my face, and you'll have to guess what feeling I'm feeling. So anger is a really great one, or the feeling. So by the time you get to in vivo exposure, you don't have anything to work on. I would say, again, I can count on 2 hands of the number of kids I've actually had to do in vivo exposure with. Most kids are completely, most kids' triggers are gone by this point, and we don't have to do the in vivo work. But for example, I have had to do in vivo work with a couple of my clients. I had one client who was sodomized with a broomstick, and she was very scared of holding a broom, sweeping, seeing brooms, all of that kind of stuff, and it was very triggering to her. So we did in vivo with her. And in these situations, you're going to create a fear, kind of a list, right? You're going to create a plan, and you're going to start with the fear hierarchy. So you're going to start with the thing that is the least scary and work our way up to the most scary. So for her, we looked at pictures of broomsticks, and then we brought a broom in.